Diabetic retinopathy versus hypertensive retinopathy. What's worse for your eyes? Have you noticed the lights at night looking hazier lately? Or maybe the words in your favorite book seem a little harder to focus on, even with your glasses? Most of us just brush it off. It's probably just age. But here's something you may not know. Blurry vision, dimmer colors, and night glare might not be aging at all. They could be silent warning signs that your eyes are under attack right now from something more serious. If you're living with type 2 diabetes or struggling to keep your blood pressure in check, your vision could slowly be slipping away without pain, without symptoms, until it's too late. In this video, we're diving into the two biggest threats to your eyesight over 50. Diabetic retinopathy versus hypertensive retinopathy. We'll break down the differences in plain English and help you understand which one does more damage faster and what you can do to stop it. If you've ever worried about losing your independence or just want to keep seeing the people and things you love clearly, this is a conversation you can't afford to miss. If that hits close to home, give this video a like. It tells me to keep making more videos like this for people like you. And keep watching, because just ahead, we'll reveal a surprising truth about which condition causes irreversible vision loss first, and how one simple step could help preserve your sight starting today. What are these two conditions? Let's break this down in a way that's easy to understand. Your retina, that thin layer at the back of your eye, is like a camera sensor. It takes in light and turns it into the images you see. Now imagine this. You've got tiny, delicate blood vessels feeding that sensor. They're like little garden hoses, and they need just the right pressure and flow to keep everything alive and sharp. But with diabetes, those vessels are constantly exposed to high sugar levels. Over time, that sugar weakens the vessel walls, causing them to leak, swell, or even shut down completely. That's called diabetic retinopathy, and it's more common than most people think. On the flip side, with high blood pressure, your vessels get stiff and narrow from the pressure. This is hypertensive retinopathy, and it's like trying to water a garden with a kinked-up hose. Blood can't flow properly, and your retina doesn't get what it needs. The damage builds slowly, quietly, and you may not notice anything until it's already affecting your vision. Here's a surprising fact. Many people over 50 actually have signs of one or both of these conditions without knowing it. And yes, it's absolutely possible to have both at the same time, especially if you're managing both diabetes and high blood pressure, which many older adults are. If this is starting to sound like your story, hit that subscribe button now, because we make videos just like this one, designed for people over 50 who want real answers without the medical jargon. But now the question is, between the two, which one poses a greater risk to your vision long term? Coming up next, we'll compare their speed, severity, and how much vision you could lose, and how fast. Keep watching with me. You need to hear this before your next eye exam. Which one is worse? Now let's get to the big question. Which one is worse for your eyes, diabetic or hypertensive retinopathy? It's not an easy answer, but here's what the science and patient stories tell us. Diabetic retinopathy is usually the more aggressive threat, especially if your blood sugar has been uncontrolled for several years. Why? Because it doesn't just leak, it escalates. Over time, those tiny vessels can rupture or die off entirely. Your body tries to fix it by growing new fragile vessels, but they're unstable. They bleed, they scar, and in advanced stages, your retina can even detach, leading to permanent vision loss. And here's the tough part. It can be progressing without pain until it's too late to reverse. Meanwhile, hypertensive retinopathy tends to develop more slowly, and if your blood pressure is brought under control, the vessels can stabilize, sometimes even improve. That doesn't make it harmless. If left unchecked, high blood pressure can cause your retina to swell or suffer from a stroke in the eye. And yes, that can still lead to blindness. But in most cases, damage from high blood pressure is more reversible, especially in early stages. Bottom line? If you're living with diabetes, especially after 50, diabetic retinopathy is the one to watch more closely. It's faster, it's sneakier, and when it gets serious, it's often permanent. If that surprised you or hits close to home, give this video a like right now. It helps this message reach more people who may not even know they're at risk. But here's something we haven't talked about yet. What if you have both conditions? What if you've been living with type 2 diabetes and high blood pressure for years? In the next section, we'll look at what happens when these two threats team up and why people over 50 need to pay extra attention to even the smallest vision changes. Don't go anywhere. What comes next could help you catch damage early and protect your eyesight before it slips away. The risks after age 50. Let's talk about the part most people overlook. What makes these eye conditions even more dangerous after age 50? The answer is time. The longer you've had diabetes or high blood pressure, the longer your eyes have been quietly absorbing the damage. You might feel fine, you might still see well enough to drive, to read, to live. But that's the trap. Retinopathy doesn't always start with blindness. It starts with little things. Needing brighter lights to read, struggling to see at night, thinking your glasses just need updating. You tell yourself it's just aging. But what if it's not? What if those are signs your retina is already under stress? In fact, studies show that adults over 50 with both diabetes and high blood pressure are 2 to 4 times more likely to develop vision-threatening retinopathy than younger people. Because at this age, recovery slows down, and small losses can quickly become permanent. So if you're over 50 and living with either or both of these conditions, this is the moment to act. Not out of fear, but out of confidence, because now you know the signs, the risks, and soon, the solutions. If you know someone your age who's brushing off their vision changes, share this video with them. You might be the reason they get checked in time. Coming up next, I'll show you exactly what you can do this week, not months from now, to protect your eyesight, even if you've had these conditions for years. We're going to talk practical steps, real choices, and small changes that make a big difference. Keep watching. This is where things get hopeful. What you can do today. So now that you know what's really happening inside your eyes, what can you actually do about it? Let's keep this simple and real. You don't need fancy treatments or expensive equipment to start protecting your vision. You just need a plan. Step 1. Schedule a dilated eye exam every single year. Not just a regular vision check. You need the kind where the doctor looks deep into your retina. Even if your sight feels fine, retinopathy can start silently. This exam is how you catch it early, while it's still manageable. Step 2. Take back control of your numbers. That means aiming for steady, healthy blood sugar and blood pressure levels. Not perfect, just consistent. If you don't know your A1C or average BP, it's time to ask. Knowledge is power, especially when it comes to your eyes. Step 3. Eat for your vision. Add more of these to your plate. Dark leafy greens like spinach and kale, omega-3s from fish like salmon, colorful fruits like berries and oranges. These foods support blood vessels and protect the retina from oxidative stress. Step 4. Watch for changes, no matter how small. Don't ignore dimmer colors, cloudy vision, or sudden floaters. If something feels off, trust your instincts and get checked. These steps may seem basic, but they're powerful. Thousands of people have preserved their sight simply by taking action before symptoms got worse. If you're already doing some of these, give yourself credit and give this video a like to let others know it's possible to take control. And if this feels like a lot, don't worry, you're not alone. In the next section, I'll share the truth most people don't hear often enough, that losing vision isn't inevitable, even after 50. You have time, you have tools, and there's still so much you can do starting today. Stick with me. This final part may be the encouragement you've been needing. Before we finish, I want to tell you something you may not hear often enough. Losing your vision is not a normal part of aging. I've met patients in their 60s, 70s, even 80s who still read, drive, enjoy the sunrise, and recognize every face in the room because they caught the signs early. And they made small, steady changes that paid off. So if you've ever felt like it's too late, it's not. You have time, you have choices, and now you have the knowledge. If this video helped you feel more informed and in control, please tap the like button. It lets me know these videos matter. And if you have a loved one, a spouse, a sibling, a friend over 50 living with diabetes or high blood pressure, please share this video with them. You never know. It might be the message that helps save their sight. And if you want more videos like this, simple, honest, and made for you, go ahead and subscribe now. Your eyes matter, your future matters, and every step you take to protect them, is worth it.